Facelift, as the name implies, is a procedure of lifting the face. The tissues of the face, as of other parts of the body, tend to get saggy with age and droop down. Now, technically, facelift would be just lifting those tissues up and keeping them there for as long as possible. Now, there are various fat compartments of the face, and they kind of sag down separately because there is some attachment between the deeper tissues and the skin. So very often you'll have a line like this, and maybe a little jowliness appearing right here. Then there would be a separate fat compartment here which kind of stays up, but then there is a distinction between the lid and the cheek. The kind of fat pocket goes down and the eyelid looks separate, and there's a deep hollow between the eyelid and the cheek. The eyes themselves are aging as well, and sometimes a little bit of fat comes out through different fat pockets just beneath the eye. All this makes the face look more mature, more aged, and sometimes not so fresh, and the face does not look happy. And very often the need for facelift is to make the face look more at peace, more in harmony, and younger and fresher. Now, this is one of the main techniques of surgical rejuvenation of the face, which can often be combined with other things, including volume restoration. Volume restoration, where you add fat or fillers to kind of get the hollows out, fill those hollows up. Those fillers can themselves do a little bit of lifting, but the essential aim of the fillers is to, first of all, fill the hollows that have appeared, and secondly, to kind of fill the junctions between different fat pockets. A good candidate for a facelift is a person who's usually in their fifth or the sixth decade, but younger people may need it sometimes because of excessive weight loss or because of just sagging of the tissues that has taken place prematurely. There are people who are much older, 70s and 80s, and I've done someone up to late 80s, where rejuvenation of the tissues makes one feel better, look happier, and more harmonious. For those people, at whatever age they are, as long as they are in good health, facelift is a good option. Usually when we say facelift, we mean a surgical facelift, although there are so-called non-surgical facelifts, which basically means either volume restoration or some radio frequency or other methods of tightening the skin, which do not involve cutting of the skin. As far as the surgical facelifts go, there have been many names to them. Some of the names are based on what layer you are lifting the face. Now, one of the common ways of doing a facelift is just doing the skin excision. That was actually the first time a facelift was done. The skin was taken up, excess was cut, and the skin was joined together. And that gave reasonably good results. However, as time went on, deeper facelifts appeared to hold longer and give longer lasting effects and results, as well as give a better look overall. Those layers that have been used for lifting the face have been either subcutaneous, that is just beneath the skin. The second layer is the SMAS layer, SMAS, which is basically the covering of the muscles. Another layer is just above the covering of the bone, that is called subperiosteal facelift. Now, depending on who you talk to, the deep facelift can be either SMAS layer facelift or subperiosteal facelift, and all of them have longer lasting results than simple skin excision. The aim of the facelift now is to replace each fat pocket to where it came from. For example, the fat pocket here in the upper part of the cheek has to go up. The fat pocket which has gone down and has resulted in some jowls and deep lines here has to be lifted up. And similarly, the jawline has to be made very harmonious and straight so that there is no jowliness, and the line of the jaw, which is one of the main things that people look at to see a youthful face and also a more pleasing face, has to be restored. The jawline has to be nice and straight. Now, with the facelift, oftentimes we do a neck lift, and neck lift is often done to remove the sagginess of the skin, as well as there are some muscle bands that are formed, those are also improved with the process of a neck lift, which is done at the same time. The excess skin in the case of facelift is removed in front of the face, and in the case of a neck lift is removed the back of the ear. Now the scars, the cuts that we make are placed very aesthetically, and for most people the scars are placed in the curves of the ear, in the on the edges of the ear and in the back of the ear. They become very minimally visible in a week or 10 days, and after a couple of weeks they become very faint, depending on the healing of the individual. Once an average individual goes out in 2 weeks, one would not notice the scars. Ladies can do it even earlier because they can apply some makeup. For males, I usually recommend 2 weeks of not socializing with the people you don't want to see. As far as shape of the face is concerned after the facelift, what happens as we age is our face tends to get longer. And if you remember the old phrase of someone is putting on a long face, means a sad face. However, now oval faces are more supposed to be aesthetically more pleasing, as well as square faces. So when you do a facelift, a more lifted look, but at the same time the length of the face looks a little bit less, and you have a lifted look like this, but you don't have that long oval shape that people like. So for restoring both the shape and keeping the oval, one has to be careful in repositioning the fat pockets. The ideal shape of the face is a triangle which has the base on the upper side and the triangle, the pointy end on the lower side. As we age, it kind of becomes the other way around. The lower part is the base with jowls and everything, and the upper part becomes kind of saggy. So once the tissues go down like a candle melting, the point is at the top and the base is at the bottom. So the aim is to restore the fat pockets and replace them where they came from, and restore the volume as well using some autologous fat from the person's own body, or using fillers. Those are equally good. The fillers last about 2 years, depending on which ones you use, 1.5 to 2 years. And the fat lasts much longer. However, the amount of fat that would remain after putting autologous fat in is a little less predictable. One may retain 60%, 50%, or 40% of the fat. So one has to overcompensate the fat. Now, along with facelift, we often do neck lift, as I said, but we can combine it also with eye lifts or blepharoplasty. Now, when we do blepharoplasty, we make sure that the lid cheek junction becomes more smooth and less conspicuous with no hollows beneath the eyes. And that would give rise to a very even, youthful, and happy look to the face. The angles of the mouth get turned up. Instead of looking sad and down, they kind of go up. So that would also give an impression of the person being happier even at rest. The results of the facelift can last 8 to 10 years for an average person. The younger the person, the longer the results last. It is basically because the elasticity in the skin is better at a younger age. When one gets older, then the elasticity becomes less. So for a person who's getting it done in their 70s, the result would last less, or would last not as long as a person getting it done in their 50s or 40s. However, one should not do the facelift just because one wants it to last longer, because not everyone needs a facelift in their 40s or even their 50s. So one has to look at the face and see what is the need of the facelift. The need is there, or the desire is there, then usually a little younger is better than a little older. One can certainly repeat a facelift, and oftentimes that is done at about 10 years. I've had some facelift last for 15, 16 years as well, and some for as little as 6, 7 years. So it's not the same for everyone. Depends a lot on the elasticity, depends on the facial tissues, also depends the amount of fat and the amount of hollowness one has. So depending on, and again, how one treats their body also is very important. Taking care of the body and the face and the skin is very important for longevity of the results. The procedure for facelift, depending on the technique used, I would say face and the upper neck, the procedure usually takes me about 3 hours, and that includes both sides of the face and the upper part of the neck. I usually do the facelift at the SMAS, SMAS, and there we do plication of the SMAS, which means lifting it up and suturing it, stitching it together, and then the lift angle of the lift is kind of oblique, a little bit up and oblique. This look, which is face in the wind look, is avoided at all costs. It looks awful after a while, and if anyone wants to see if a facelift has been done, that is a telltale sign that someone has had a surgical procedure done, which defeats the purpose. One wants to look younger and better and more at peace, but should not be obvious that it had to be done surgically. So, the face in the wind look has to be avoided. At the same time, changing the shape of the eye has to be avoided. And also creating false fat pockets where things look bulgy, and sometimes if you put too much filler, it looks like there's a pillow sitting right here. Those things have to be avoided. The face should look in harmony, soft, lifted up, younger, and happier. Those are the basic aims of the facelift. The recovery of the facelift in terms of looking fine can take anywhere between 10 to 14 days, sometimes a little bit longer. By the end of 6 weeks, you look very good. Most of the improvement can be seen at this stage. The bruising, if it is there, can take 2 to 3 weeks to go. Most often it becomes very light by the end of 2 weeks. In terms of going up and around, the same day a person can be up and around. It's just the socializing part which one has to kind of delay a bit because of the looks, because of a little bit of bruising and swelling and so on. The sutures are usually removed on the 8th day, 7th or the 8th day, and one can go around without any dressing after that. We usually give a little bit of a Velcro strap to hold things up and decrease the swelling, but it is not absolutely essential after the first week or so. Again, in terms of going around and doing your work, desk job, it can be done right away. There's no waiting maybe a couple of days just because of some discomfort. But after that, working on the desk or talking to people on the phone is not a problem. Socializing, again, as I said, about 2 weeks, sometimes maybe a little bit longer. And as far as doing heavy workouts, it's a workout where your muscles of the face are going to be stretched and you're going to have a lot of increased circulation and stress on the face. Those should be avoided for 6 weeks. In terms of your hair color and hair shampoo and so on, one can do that in as soon as 5th or 6th day. I usually recommend people to color their hair right before the procedure so that one can wait for a few weeks. In terms of washing the hair, I allow that as soon as 4 or 5 days. And that depends on how you feel comfortable, but even sooner may be possible. Now, the shampoo that you use after a facelift should be a baby shampoo to minimize the risk of irritation of the scars which are around here. And once you apply shampoo here, it is going to flow down. The face has to be kept dry as much as possible, and some moisturizers can be used soon after the surgery, a couple of days after the surgery if required, only for the areas which have not been surgically cut or other procedure done in the area. So moisturizer can be applied in a couple or 3 days to areas which don't have cuts on them. Other procedures that can be combined with facelift, as I said, blepharoplasty, which meaning lifting of the eye and removing excess fat, upper eyelids, as well as putting fat and fillers if needed. Sometimes we even do a little lip lift with it when someone has a very long upper lip or the distance between the nose and the lip becomes very long, then it can be lifted up at the same time as well. Very often some ladies will have these little vertical lines, and that can be taken care of with laser or dermabrasion at the same time. So eyes, face, neck can be done at the same time. Sometimes some implants can be done, like a little chin implant if required, to restore the shape of the chin and improve it. Fillers, as I said, can be done at the same time, or otherwise they can be done a few days later. You do not have to wait to get fillers done. They can be done right away or in a couple of days or 10 days. It depends on you. But there is no mandated time period to wait. However, after the procedure is done, you should not do fillers in the area there which have been lifted. So if you've lifted this part, wait for the fillers for a few weeks before you do fillers here. But if you lifted just this part, then fillers can be done in parts that have not been lifted. Then there are some forms of facelift that are more limited, like a lower facelift, which just involves a cut here and the back of the ear, and you lift the lower part. Then there's a mid facelift. Mid facelift can be done through a small cut here, and you can lift it up like this, or with the blepharoplasty incision, you can lift it up like this. So those are also good procedures when limited amount of facelifting is needed and when one is not prepared for the full procedure. However, the full procedure and mid facelift as well as lower facelift have the same issues as full regular facelift. So one has to weigh the pros and cons of doing the full facelift versus a minor facelift. Lower facelift, a mid facelift, or forehead lift. That's another procedure that we often do, forehead lift or brow lift. Those two can be combined with the facelift as well. And if you do just mid facelift, sometimes with people who do mid facelift can combine it with a brow lift or blepharoplasty as well.